You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Why hasn't conventional medicine been able to cure many of today's diseases? Because many scientific findings never make it into the mainstream medicine. Millions suffer and die while proven therapies exist. The good news is that a leading anti-aging physician and the anti-aging secrets discovered by the renowned Life Extension Foundation are revolutionizing medicine. Now reaching middle age and beyond no longer means inevitable weight gain, joint pain, cognitive decline, heart attacks, strokes, or cancer. My first guest is the author of Life Extension Revolution. He is here today to discuss bioidentical hormone replacement therapy. If you are taking hormones or would like to know if you would be a good candidate, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, bioidentical hormone replacement therapy for women and men. My guest today is Philip Lee Miller, MD. Dr. Miller is the author of Life Extension Revolution, the new science of growing older without aging. Dr. Miller, welcome to the program.
Thank you, Randy.
Now, the title of your book, it says Growing Older Without Aging. Let's start there.
Right.
What does that mean?
Well, what it means is, for the first time in history, we really have the ability to face the prospect of growing older chronologically without feeling older. And some of my heroes that I look to are Jack LaLanne and Sophie Loren, who we look to people in the 60s, 70s, and 80s who are still vibrant, young, and active. And that's what we have to look forward to. It's the entire baby boom population, which is now approaching 60 and almost 65.
Do you have patients, by the way, that are in their 60s that say, I feel great, I feel like I was in my 30s?
I have patients who are now in their 70s who feel great.
So who is your typical patient then?
We don't really have a typical patient. We have people who originally came to us for menopause, andropause, and for our main charter, which is anti-aging medicine. So now it's broadened. Our category really is from 32 to about 82, even though our target is 45 to 55-year-old people. That's who we're looking for, the 40 to 55-year-old segment. We're looking for the leading edge of the baby boom population. So they come to us for a variety of reasons, even though our main charter is anti-aging medicine.
Okay, what are the main components to your program? So a woman goes to you, and we invite you on the show today to talk about menopause, andropause, bioidentical hormone replacement therapy. So tell me about your overall philosophy and approach when it comes to that.
Our approach is to approach things as naturally and as completely as we can. We try to get to the bottom of what is bothering you, as opposed to just giving you an agent, a drug, a prescription, and you're out the door in 15 minutes. We spend a lot of time with you. We spend the time necessary to figure out what's going on, what do we need to do to rejuvenate you, to make you feel better, to make you perform better, to make you actually 10 to 15 years younger than you were when we first started.
Now, are you an alternative medicine doctor? I mean, how do you classify yourself? We talked early on about functional medicine, things like that, but do people say that guy's alternative medicine? And what is your response?
What I say to my patients is we do alternative medicine, but that's not really what we practice. We use alternative medicine techniques, but of all the labels, and there's a lot of these labels, okay, Randy. We use integrative medicine, there's complementary medicine, there's anti-aging medicine, rejuvenating medicine. What I like to use, if you're going to put a label on it, is integrative medicine. Integrative medicine is everything that I've been doing for 35 years.
So you use mainstream approaches?
So I use a lot of mainstream approaches, and I continue mainstream approaches that people have come to me with, but I have a larger toolbox.
Bioidentical hormone replacement therapy associated with menopause and andropause. What is the menopause and the andropause? I mean, what's happening? Give me a basic idea.
Menopause really starts at about 45. It reaches a crescendo at about 48 and stops, or really climaxes, at about average of 52.
So what's happening? I mean, hormones just start to decline?
What's happening is initially there's some mood changes. And then eventually at about 48 there's mood changes and emotional volatility and memory changes, what we call memory fog. And so that's the reason.
Isn't that just part of aging?
Well, certainly. I fight this myself all the time. But the problem is, and the answer is, that this really is hormonally mediated. And some women who've come to me with this mental fog and these emotional volatility and all the changes they're going through are better in a week.
With bioidentical hormone
with
replacement.
bioidentical hormone therapy. So it doesn't
So
mean
their PMS
everybody
goes away, things like that.
the PMS modulates, the memory fog lifts. I've had women who've gotten job advancements within a month because they got so much better. And so what happens is, if you look at the hormonal changes and how strong hormones are, they really change our emotions. They really do affect how we think, how we act, and how we performed. And if we can modulate those in a physiologic, in a really careful way, you get great results.
How are you treating the menopause different than, say, what a primary care physician or a gynecologist would treat it? A woman, I guess, is starting to have irregular periods, hot flashes, things like that. What is the standard, and what is it you're doing? Are you doing the same thing?
Not at all. Not at all.
Okay.
I think the standard becoming more and more, it was Premarin and Provera, and now we've had a lot of problems with that. So the standard really now is becoming, I'll give you a little Prozac, I'll give you a little antidepressant.
Is that really what's happening?
Well, there's a depression, but the depression is not really at the seat and the cause of what's going on. And so what you're doing is you're treating symptoms, you're masking them. So you're just treating and modulating certain effects of the menopause, but you're not really getting to the bottom of it, which is what's mediating this? What's causing these changes? If we can get at what's causing these changes and mediate it from the bottom up, you're going to have much more profound...
So the standard of care, they go to their doctor, they're feeling lousy, depressed, irregular periods, and they're given a little Prozac, you're saying? I mean, you've heard this from...
Typically what they're giving in is an SSRI, because we've had so much being talked about with regard to hormones and so much misinformation with regard to hormones that everybody is really in a quandary. What do we do about this?
I've been anticipating this interview. Very dangerous.
Well, I
What is
think
your
a lot
response
of
to
this is really based on the Women's Health Initiative. And the Women's Health Initiative was a study in Premarin and Provera. Those
Okay.
are not natural hormones. Those are hormones that are what I call xenohormones. As we know, those are horse estrogen. Those are not natural. And it's well known that these hormones have more side effects. They're not natural. So if we go to the ones that are natural, what are in your body that are diminishing what's falling off, we simply replace what you are falling off in, which is estradiol and estrone and testosterone in men and testosterone in women. If we do these physiologically, carefully, responsibly, and naturally, or bioidentically, much better results.
Do women feel the way they used to feel? Is that what they say to you?
Women say, I feel me again. That's the big payoff to me. It's a huge payoff, because what they're saying is, this is why I came to you. This is what I knew I felt 5 or 10 years ago, before I started going through all these changes. When I really thought, maybe there's something wrong with me. Maybe there really is something going nutty with me. Maybe it's something about me. And that's why I came to you, to find out, is there something that can be done to really change what's going on with how I perceive the world, how people are perceiving me, my emotions, my memory, how I'm dealing with my kids, my husband, do I want to get divorced? All of that stuff can be changed with hormones.
Now, you use the word replace. Are you replenishing? Are you replacing? Does it mean the same thing?
We know as we get older that hormones are falling off, our enzymes are falling off, that a lot of physiologic functions are naturally falling off. And
Okay.
all we're doing is just gently replacing those and elevating them to...
So it is replenishing.
It is replenish them. It's like, putting water back in the trough again. It's like putting you back to where you were 10 to 15 years ago.
Now, this is your expertise, I've been told. But for those just tuning in, what is your background, your training? How long have you been doing this? What continuing education do you have when it comes to bioidentical hormone replacement therapy, longevity medicine, this kind of thing?
Well, my whole life has been preparation for this, really, in retrospect. If you look at, I graduated from Berkeley with a degree in biochemistry, some of the best people in the world. And then I went to UC San Diego in the charter class, And I was studying biochemistry there, and my friends and I, we were studying nutrition, kind of on the side. And I had friends who wanted to go into nutrition. 15 years ago, I started feeling crummy, and I knew something was going on. And I learned that there were certain things that I had to take care of in my own health, and it started me on a new path. And so everything that I've done has sort of moved into what I'm doing now. So I'm eminently qualified, given my degree in biochemistry, the training that I've had at UC San Diego, UC Berkeley, UC Davis, in neurology. I have the training, plus the training that I've had in the 20 years that I had in emergency medicine, which gave me the background to deal with things rapidly, quickly, and creatively. So I come to this with a lot of experience in really being able to figure out things quickly, to be able to solve problems where there may not be answers, where you have to create these answers. Okay?
What frustrates you, by the way, the most with the way medicine is being practiced today? Generally speaking, overall.
I think what frustrates me the most is that we have a healthcare system that's not a healthcare system. It is disease management system. You've probably heard this before.
Okay.
But really what this means is it's all based on disease. What's the disease category? In parlance is, what is the ICD-9 code? What is the specific diagnosis that I can then submit to the insurance company, that I can code, whether it's diabetes, whether it's arthritis?
Any different than that?
And what I'm doing is completely different. What I've really focused in on is functional medicine. Functional medicine is, yes, I'm really careful that I'm not missing anything. I'm not missing a particular disease. I'm not missing anything. I'm still very articulate and very comprehensive in terms of how we put these together. But I go beyond that in terms of really what's important to you is not the disease. You don't care about the fact you have diabetes. You don't care about the fact that you have menopause. What you really care about is, I don't feel good. I don't feel right. I'm not performing well. Everybody's mad at me. I'm mad at everybody else. What I'm interested in is feeling better and getting back to the way I used to be.
And you see that every day in your practice?
I see this routinely over and over again.
Okay. We're going to take a quick break. We come back. Let's discuss the commonly replaced hormones and what some of the hormones are responsible for. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Our topic today is bioidentical hormone replacement therapy. Our guest here is Dr. Miller. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Miller, who is the author of Life Extension Revolution, and we're talking about bioidentical hormone replacement therapy. Okay, Dr. Miller, before we go into the commonly replaced hormones, at what age should somebody do something about it? Let's say a woman or a man.
Well, I think people should come to see me when they're in their 40s. But typically, people come to me when something's happened. And so typically for a woman, most of the time I'm seeing them when they come to me at about 48 to 50. Guys, I'm usually seeing about 54 to 56. So it depends. If a woman's coming to see me, it's because she's going through what I call the crescendo phase of menopause. She doesn't feel right. She's coming in because it's not working right. Brain's not working right. Brain fog. Not performing well at work. Guys, on the other hand, are coming to me for other reasons. They're coming to me because their libido's down, their performance is down, their strength is down, or they just don't have the motivation, the vim, the vigor, the determination, the drive to do what they used to do. They're losing interest in their practice. They're losing interest in their business. They're losing interest at work.
Is your practice a 50-50 practice, women and men?
It's really interesting, Randy, because in a typical medical practice, I think what you'd see is you'd see much more women than men. And the reason is, this is one time when women take care of problems. When women get sick, women come to see doctors. They take charge and they take care of problems. This is unlike what we normally do. And when men get sick, they only come to see me when they're really, really sick. So in my practice, the interesting thing is because it's very oriented toward preventive and toward future health, it tends to be balanced. So I see about 50-50, men and women. So I see the guys that come to see me because they really do want to feel good and perform well for the next 20 years of their life. Now, I see women for the same reason.
Now with women, when I think of menopause, I think of hot flashes. I mean, is that usually and irregular periods, is that a big indicator of when they need to come in?
That's typically what starts it out. And again, that comes at about age 48 to 50,
Are those
51.
easy to take away, by the way,
Those
for
are
you?
easy. That's the easy part.
Women shouldn't have to live with that.
No, no. That's the easy part. Virtually no woman should have to live with hot flashes. And we sort of, as men, joke about hot flashes, like, hot flashes. I've had women come to me in my practice, and while they were sitting in front of me going like this, they were having such distracting hot flashes. It's a wave that comes over you. It's like ice water being poured over you. It is really, really uncomfortable. And women can have these maybe 10, 15 times a day, might be 2 or 3 times a day. But if it's 10 or 15 times a day, it's too distracting. You can't do anything because you're always having these. That can be stopped in a week or two, and it should be.
Now, you said the ages, 48, 50, typical. Would you like to see them younger coming in?
Yes.
For preventive?
Yes, I would. And the ones that really do well, the ones that I love seeing, are the ones that come to see me at age 40 to 44.
Okay.
Those are the ones that are forward-thinking. They're the ones who had really come to me because they're having symptoms. They don't want to have the symptoms. They want to slide through that. They know what they're going to go through, and they want to avoid all that. They want to remain young and youthful and vigorous.
Now, I've been told
20 or 30 years.
I've been told you have a practice, high-profile patients, business executives, business owners. Why is it that you think you attract these people?
These people come to me because where I'm at, in Silicon Valley, people come to me because performance is everything. Both men and women come to me because performance is everything. So whether you're a CEO, whether you're a senior level executive, or whether you're even junior level executive,
They want that competitive edge.
they need that competitive edge.
This gives them that?
It could be a dentist.
Okay.
It could be a lawyer. It could be top level executive. It could be CEO. It could be anybody who's running their business. They need to have the motivational edge, the drive, the stamina, to feel like when they come to work, they really want to be there. People come to me because...
Is that what you hear, really?
Yes. People come to me because what they tell me is, I've been doing this 10, 15 years, and I don't enjoy coming to work anymore. And I'm the main reason for work being here. I'm driving this company. They come to me because they need to be the captain of the ship. They need to be the one that motivates everybody. They need to be the one that really is the team leader, is the coach, is the one who's really out there.
So with bioidentical hormone replacement therapy, these same people that you've mentioned tell you they get it back?
Yes.
They get that drive back?
What they get is they get their life back again. That their whole business, their whole life is transformed. It's transformed because now they enjoy coming back again. That drive, that motivation, the enjoyment, the enthusiasm, all of that they had when they first started their business, whatever that business was, is now they're getting that back again. They enjoy coming back to work again. And they're workers, their co-workers, their husbands and wives, everybody around them sees that they're happier. This is about happiness. This is about how can you be happy again.
This is
with
not
what
an
you're
overstatement. I mean, because sitting here listening to this sounds like a bit of an exaggeration.
It does sound like an exaggeration.
It's not.
But it's not, because I go back to something really basic. And one of the most basic things that I tell people over and over again is, the Declaration of Independence guaranteed us life, liberty, and the pursuit of happiness. This is not a vague notion. This is a notion that's rooted in the essence of our country. So it's not just a whim. It's not something that we're being sold a bill of goods. This is something that really is at the most philosophical core of what we as Americans are all about, is the pursuit of happiness. It's not a superficial thing. It's a gut thing. It's an emotional thing. It's really, do you really feel happy with yourself? Do you feel happy with your spouse?
And they get that back with hormones.
They get this back with hormones.
And the right.
Yes.
Let's begin with the commonly replaced hormones.
Well, if you look at those, the most common ones would be estrogen, which comes in 3 forms, testosterone, DHEA, but then it goes beyond that to thyroid, could be growth hormone in some instances. So what we look at is we look at the whole cascade. We look at the balance between these hormones. We look at the balance between estrogen and progesterone. We look at the balance between progesterone and testosterone, between estrogen and testosterone. So we look at 3 balances. So we don't look at just levels. It's not just about getting levels and looking at these.
Levels from blood work, you're saying?
From blood work, from whatever way we could do it. It's not just that. So people who have test themselves, I tell them, this is at the grandmaster level. This is really looking at the chessboard and seeing 10 moves ahead. This is not just saying, oh, here's the next move. This is what's the next 10 moves going to be, because you have to look at the balance. What are we trying to establish
Now, you
here?
said grandmaster. Do you consider yourself a grandmaster when it comes to this?
Yes, I do.
Okay.
Yes.
Because women are always coming to me saying, who is good at the hormone replacement therapy?
Yes.